majority of the folks in our work group are from the Mid-South Network, with the exception of one, Wendy, who is from Karn. But it's myself, Naomi, Wendy, I can't think of you, Mary, Tanya, Angelique, Nicole, and Vivian. And as you all know, we are working on the issue of childhood obesity. I think we kind of got this switched here. But what our framing question was yesterday was, why is the childhood obesity rate increasing if experts know how to reduce it? And so what we're really looking to do is how can we affect state policy to ensure healthy food provisions to SNAP recipients? We said that we were going to be doing this by launching a public service announcement campaign, and we're going to be doing that first through pilot sites in Arkansas, Mississippi, and West Virginia, through local clinics and hospitals, the state extension service offices, and really aiming to reach public benefit recipients of SNAP. How will we get there? Our first deadline, I guess, is to contact potential video producers to create RPSAs. And then our next goal is to, by June 1st, to have researched other states' PSA campaigns and SNAP education programs. And then by September, our goal is to have collaborated with health providers throughout all 3 states. Our 30-30 is kind of not a 30-30, even though we do have our first goal being May 1st. Our next meeting is going to be on June 1st, and it's going to be a conference call. But the reason why we're here is I think this is something that we've recognized for a long time, but that high statistics of obesity, there's just a really strong correlation there with high rates of poverty. And that's something that all 3 of our states have in common. So I think that's it.
Good name.
Oh, and Angelique came up with this wonderful name. I had a hard time believing that she came up with it at first, but it's going to be called, well, it's really, really good. And I was like, did you just come up with that at the top of your head? But it's called Habit. Our PSA program is going to be called Habit, and it's health achievement by breaking individual traditions.